The preceding chapters in the theoretical part of this DVD discuss the nature of movement, structural anatomy, and pathology. Familiarity with these chapters make it easy to understand that even minor injury weakens the injured region immediately and significantly. Note that weakness of the region is a precondition for severe re-injury and will persist even when pain sensation will subside. Also be aware that inhibition of pain is a sign of the partial reduction of inflammation, but is not evidence of its elimination. It's important to understand the reasons for power reduction in the injured region. 1. Strained muscles shorten and inflame, which prevents them from participating fully in movement and stabilization. 2. Inflamed tendons reduce muscular potential in transmitting power required for movement and stabilization. 3. The nerves within the region are also traumatized. As a result, they cannot conduct sufficient motor impulses to awake full muscular response. 4. Due to lack of muscle usage during the post-traumatic period, the muscle mass is temporarily reduced. 5. Inflammation of ligaments contributes to instability of the joint. Proposed massage techniques, trigger point therapy, hot and cold applications contribute significantly to reduction of pain and partial restoration of power in the injured region. But the final necessary set of steps in eliminating the above-mentioned dysfunctions and restoration of adequate power is neuromuscular re-education. Let us present to you the concept of neuromuscular re-education in greater details. Each muscle can produce movement in only one plane. A complex movement that requires positioning in several planes or rotation is supported by several muscles. Muscle contractions are managed by nerve impulses fired in a specific sequence or in parallel, ensuring that contractions of all muscles propagate the overall movement. This fine-tuned sequence of impulses causes muscles to work together or in assembly. Muscle assembly work is a characteristic to normal, not traumatized muscles and nerves. When an individual experiences trauma in a joint or muscle, the nerves that service the injured region are also traumatized. This means not only that joints in the traumatized region lose stability and muscles lose bulk, but also that some associated nerves don't fire the properly timed impulses. As a result, some muscles that ought to carry some portion of the movement don't carry it. Work of such muscles has to be delegated to the remaining muscles, leading to their overwork and in general to inability of the region to produce the movement to the extent that a healthy region could. In such a case, we refer to these muscle groups as not working in assembly. Neuromuscular re-education is a sequence of techniques and exercises that reinstates the proper work of the muscles in the injured region, realigning proper work of nerves and teaching muscles to work in assembly once again. Neuromuscular assembly work training that includes isokinetic exercises causes neuromuscular re-education and, at the same time, it contributes to gross muscle mass increase. Another important component of neuromuscular re-education is referred to as post-isometric relaxation techniques. These techniques implement isometric and post-isometric exercises that are necessary in order to eliminate muscular disease. Both isokinetic and isometric exercises are explained in the muscle tone section. In order for successful results of neuromuscular re-education, no matter whether it is post-isometric relaxation techniques, isokinetic, or isotonic exercises, movements have to be performed slowly. The warm-up routine that Boris proposes in vertical and horizontal positions is another part of neuromuscular re-education that teaches muscles to work in assembly. This routine also proportionally activates muscle groups, balances muscular tone, and fills up microscopic blood vessels with arterial oxygenated blood. The warm-up routine is offered on a separate DVD. Summarizing, all neuromuscular re-education methods are must-dos because they are equally important in order to prevent sports injuries and re-injuries, to rehabilitate yourself from an injury if you sustain one, and to prevent acceleration of osteoarthritis development. If you would like to purchase this DVD, please click the link on the right of this video under Boris's picture.